Thank you, President, and I rise to speak on the Department of Health's annual report on drinking water quality in Victoria 2021-2022. The report does a great job of updating and summarising Victoria's water quality performance and the Department's activities during 2021 and 2022 reporting period. The Department does a fantastic job of maintaining and improving the regulation of Victorian water agencies to protect the public from waterborne health risks water consumptions can cause. Not only this, but also highlight their preventative risk assessment work, which operates to mitigate any problems the consumption of water can cause. We all know how important these services are for the state. Maintaining Victoria's world-class water supply system impacts all of us every single day. Drinkable and safe water is a right and a need and applies to everyone. On top of this, I'd really like to point out the incredible work the Department does to ensure that this system is even more resourceful. I'd like to applaud the Department for their multidisciplinary approach to water management. They ensure public health is maintained while also safeguarding human environmental elements, which includes animals. These workers are just brilliant. Their routine inspection, system maintenance and asset repair and replacement work could not be more important. They prevent incidents from occurring and monitor environmental hazards. I commend their proactive stance in what they do. We know that in the path of water from the catchment to the consumer, there are many possible sources of contamination that must be proactively managed to avoid the detrimental impacts to public health. Their identification, control and monitoring of risks to the water supply keeps us all safe. The report continues by outlining how the Department considers the potential future impacts of climate change and the influence that the environment factors can have on operational performance. The water management processes highlight the important research, and the contents of the report are key in harnessing advances in science and technology. These developments, research and innovative work to improve our state's resources, and how great is that to see such developments translated into practice. Our system has built resilience and continues to deliver on public health priorities. I was proud to learn that water quality standards are improving across Victoria, even just compared to the previous year. 488 localities, that's 98.3% of the state, continuously met all water quality standards in the regulations year 2021-2022. That's up from 465 localities, or 97.7% of the state in the previous year. How good is that? I'm proud to know that the bar keeps getting raised and that Victorians are protected. These water quality standards are measurable and effective in ensuring that people and the wider community are protected from terrible diseases such as E. coli and avoid elevated levels of triethylamine, which can lead to negative health effects such as cancer and adverse reproductive outcomes. It is incredible to know that the Department works to make sure that these integral processes run smoothly and that their oversight continues to ensure that water qualities are set at a high standard. And 468 localities can rest assured that they are being looked after and that their health is utmost importance. I would also like to take a moment to acknowledge how far the development into the water management system has progressed over time. Continuous research and aid into the provision of water, the development of biotech, helps and strengthens our communities in many ways. Thinking back, I remember when water fluoridation was introduced in my area of Southern Metro. That was back in 1977. These forward-thinking ideas and the development of science and technology has helped Victorians and families and the community a great deal. It has saved Victoria at an estimated $1 billion through things like avoided dental costs, days away from work and schools and other costs. And that is just one of the many reasons that I am proud to speak on this report today. President, their work strengthens Victoria and helps us thrive in more ways than one. I thank them for their work, and they do, and look forward to continue advocating for Victoria's public health measures to be of the highest standard. I would like to thank Minister Shing and her office for their leading work in this space, work that led to Water Melbourne in 2022, taking out the IXM's best tasting tap water in an Australian competition. I commend this report to the House.
Ms Lovell.